Bridging the Gap Evidence-Based Practice for Type 2 Diabetes Management. Background on the criminal problem. Type 2 diabetes is becoming more commonplace worldwide, affecting millions of people. Complication, heart disease, neuropathy, and renal failure are among the risks. Present difficulties, care inquiries, follow treatment protocol, and lifestyle adjustment. A major public health concern, millions of people worldwide suffer from type 2 diabetes. Serious issue results from it. Straining healthcare system is addition to affecting individuals' health. There is a need for a new strategy to therapy because concurrent management approaches frequently fall short in addressing inequities and encouraging critical lifestyle changes. PICA question. Adults with diabetes putting an organized lifestyle intervention program into action. Typical medical attention, higher levels of glycemic, in more than half a year. Our investigation into the relevant efficiencies of destruction lifestyle treatments and standards care will be guided by the PICA question. We are able to measure the effects of these therapies by concentrating on glycemic control over a period of 6 months. Stakeholders impact. Those who directly benefit from better management technique, healthcare provider, dietary, doctors and nurses who provide patient care, health care organizations, hospitals, and clinics working to improve diabetes treatment. Those who create guidelines and health policies are known as policies makers. Patients who will directly benefit from better management are among the stakeholders. As a healthcare professional who must implement new procedures. In order to ensure long-lasting benefits to facilitate these changes, organizations and literatures are crucial. Action plan for implementation. Suggested practice. Implement structured lifestyle interventions such as physical activities and dietary advice. 12 months is suggested timeline for completing intervention. 1 to 3 tolerance of sources and training. 4 to 6 start of the pilot program. 7 to 12 complete implementation and assessment. The first step in the 12-month action plan that has been developed is a teach healthcare provider on the new intervention. Resources will be necessary for patient involved as well as staff training. Potential barriers for implementation. Knowledge gap. Employees must receive new protocol training. Limited time for medical professionals to interact with patients due to schedule constraints. Budgetary restrictions on program material and training are known as resource limitation. Patient motivation. Encouraging the patient to stick to their new lifestyle. Implementation may be hampered by a number of factors, including patient loss of motivation and providers' knowledge gap for the program to be successful. Several issues must be resolved. Baseline data for outcome evaluation. HbA1c levels. Determine baseline and 6-month follow-up value. Survey of patient satisfaction. Gather quality input regarding the success of the program. Use wearable or self-reported surveys to measure physical activity level. We will require baseline information on patient satisfaction, physical levels, and HbA1c levels in order to assess the efficacy of the therapy. These indicators will let us know where we come and where we still need to develop. Search strategies and database use. Google solely is one database. Type 2 style, lifestyle modification, and glycemic management are the search team. Peer-reviewed articles will focus on clinical outcomes that were published within the 5 past years, where a selection of criteria. In order to make sure that our implementation strategy is based on the most recent and permanent research, a competitive search of recent literature, reliable data will be conducted. Summary of evidence. Critical appraisal. Lifestyle treatments are supported by high-quality randomized control studies. Evidence suggests that structured programs significantly lower HbA1c. Reach out contents and people are taken into account to guarantee accountability. More to expect to take into account. Everyone's informed consent is obtained. Guaranteed of participation privacy. Managing such conflicts of interest by being open and honest. The body of research clearly shows that lifestyle modifications are successful ways to manage type 2 diabetes. In order to safeguard participants' rights and maintain transparency during the studies, ethical considerations are essential. Outcome evaluation criteria. HbA1c level changes to the outcome measures, rates of the patient, chance to lifestyle modification. Evaluation of quality of life pertaining to health in line with the corporate aim. Reduce expenses, better work-life provides balance, better patient results, and improved patient experience. The cooperative aim of healthcare will be reflected in our evaluation criteria, which will examine both critical outcome and patient experience. The goal is to enhance an evidence-based practice approach to type 2 diabetes management that enhances patient outcome. Call to action, motivate interest patient parties to back the application of lifestyle modification. In summary, implementing these evidence-based procedures will promote a more efficient healthcare system in addition to bettering patient outcome. I implore all parties involved to participate in this effort for improved diabetes care.